Due to the restrictive measures in Bogota, the epicenter of infections in Colombia, some vulnerable sectors of the population have hung red rags in their homes as a measure to ask for food and economic aids. In the midst of this situation, the health sectors are concerned about the government's failure to acquire the vaccines on time. Let's see the report.
This was the scenario of the streets in Bogota after the night curfew was decreed. It is part of the measures adopted by the authorities to reduce the spread of the COVID-19. In some areas, measures are being more restrictive, and there, red rags have been seen again, a demonstration from the low-income families as a sign of hunger.
I don't have an income, so I should have this. The mayor said she should give us some aid. Let's see if I get it. That's the reason. At this moment we are not in a good situation, and we would like to know if they can support us financially, because there is almost nothing to eat anymore, and I have had to knock in every house asking for something. I do this mostly for my children.
Experts assert that these measures should be taken with more investments in clinics and hospitals, as well as economic and food aid for the most vulnerable population, complementary actions that must go hand by hand with those already taken, as well as prevention policies where governments have failed, favoring other sectors.
The national and district governments have failed to control and prevent COVID-19 in Colombia, and what they are doing is enforcing measures to mitigate the damage caused by the virus. So we should analyze why the national and district government failed, and the fundamental reason is because they have privileged the economic interests of the trade and industry associations over the Colombia's right to life and health.
Por encima del derecho a la vida y el derecho a la salud de los colombianos y de las colombianas.
While the Colombian government says that the first doses of the vaccine will be supplied in February, various sectors are concerned about the delay in both the acquisition and the kind of contracts signed with the major pharmaceuticals, as the same government claims that there are confidentiality policies that prevent disclosure.
There has been a lot of secrecy in government's management regarding the purchase of vaccines, imposed on the one hand by international cooperating in the sense of demanding confidential clauses, and on the other hand, their weakness in terms of defending the national sovereignty of countries such as Colombia and others in Latin America is also evident. The consequence of this has been, in this country, for example, we do not even know how much Pfizer vaccines or those of other vaccines provided cost.
The concern continues to grow since health analysts describe that the government have improvised with regard to the development and impact of the virus. The management of the vaccines acquisition by the government is inefficient. They claim the country is not yet logistically prepared to reach the most distant territories of Colombia and protect the population through vaccination.
Hernán Darío Tobar, teleSUR, Bogotá, Colombia.